I think one of the important aspects is to get it on a local basis. You mentioned the demonstration in Huddersfield, which thousands were involved in at the time of the summit. Well, I organised a similar petition in Halifax against what was happening was that the two hospitals, Huddersfield and the local Halifax hospitals, were being turned against one another. So we were fighting one another. You were fighting to keep all the services in Huddersfield, and we were fighting to keep all the services in Halifax. I think that is a danger, and that the way to get people involved is to get local issues rather than these sort of airy-fairy national considerations, which I agree are very important, but local issues are what local people are particularly concerned with.
And the feelings out there, Kenny. As I said, I've had countless correspondence from people in Halifax. They really do. Everybody cares about the NHS and are proud of it and don't want to lose it. So it's about organising, getting people to meetings, getting better publicised, I suppose. And the unions organising, because they're one of the best at organising, as we've seen in the rally here in February and the rally in London. Most of it done by unions.
We still have time for more contributions and discussion, yeah?
Can I just ask the panel, a lot of emphasis is being put on the hospital services. Where do the community services stand on that? Because, it was said on the radio the other day that some of the justification for the ward closures is that more of the care can be given in the community. Well, by whom? The big society.
Yeah, I think you've got a very good point there. The government sees care in the community as a cheap option, and that's why they're pressing it. But unfortunately, they're not providing the additional nurses and facilities to look after patients who are discharged home to the care in the community, and that's something I've been rabbiting on about for a long time, with the reduction in the number of beds, patients being sent home the day after operations. Very good if you've got the same standard of care that you get in hospitals after you've got home, but that just doesn't happen. And the people involved are strained to the utmost trying to look after these patients. I can remember going around visiting a block of flats during an election, and the social service worker visiting the people there shouted up the stairs, "Are you all right, dear?" And dear said, "Yes, I'm all right." And that was the care she was getting. And old people don't like to complain, and that's a very, as I say, I think there's this illusion that care in the community is a cheap option. Well, it isn't. It shouldn't be, certainly.
Can I just come in on
Yeah,
that as
just
well?
quickly, Paul, and then you.
Yeah. I work for Calderdale Huddersfield NHS Foundation Trust. Calderdale Community Health Services has just, in the main, come in as of the 1st of April this month into my trust. So it's part of the Foundation Trust. In the Huddersfield side, NHS Kirklees Community Health Service team, from the 1st of September this year, they are going to be in a non-NHS organisation called a social enterprise. And I don't necessarily agree with Mike in terms of it might be okay. I know you were just doing it in terms of the wordplay. But they are not going to be in the NHS. They are going to be a separate, not-for-profit organisation, but they've only got a 3-year contract. At the end of that 3-year contract, EU tendering law is going to come into this, and there's a lot more I could have said about that, that's going to allow another private company to come in, take that service over. So the whole aspect of continuity of care, going from your GP into the acute sector, getting your treatment, then leaving the bed as early as possible so that you could go and get adequate care in the community. Again, the privatisation aspect is going to impact on that.
Just want to come back to a point raised earlier about how you're going to mobilise the public or educate the public. I just want to sort of say, why is it? I feel there's a lot of emphasis on NHS services in terms of the clinical model, but the wider model of healthcare is much more about sort of health determinants, and we're already seeing massive impact in the voluntary sector, which has in the last 20-30 years blossomed, if you like, and begun to meet some of the needs of some of the most excluded groups in our community who have the worst health of anyone in our community. And I've just lost my job. I was working in the voluntary sector, working with homeless people around health. Everywhere I go, from women's centres to women's aid to Asian community groups, often with a health remit, but with a wider focus. And the public doesn't get that at all, and it's completely missing from the discussions that we've heard here tonight. And if we really are kind of still want to keep, or maybe not this government, but the future Labour governments, if we get them back in power, hopefully they'll be a bit more, fulfil the aspirations of the ordinary people like myself. But there was an agenda of meeting health inequalities, and we're losing years of expertise that takes a lot of, it's going to take a lot of replacing, and it's going, I work for Bradford, and out of 120 community health projects, shall we call them, with a focus on the most unequal people in our society, an awful lot of those have gone. And they're not being replaced by anybody because they're invisible to the public. A lot of people don't even know that exists, And mental health practitioners are going, CAMs are losing, mental health workers working with young kids cutting and all the rest of it, suicide. I mean, there's a really, but it's not part of that sort of ward doctor stuff. And that's already going in a big way, We need to be getting that message out to the public, because if you can put that in real terms, that children that are self-harming are no longer going to have anyone to help them, then you're going to help win some hearts over,
We do still have a little bit more time, yeah?
Yeah, just to come in on a couple of points there. I think what was said earlier about the consortia commissioning hubs. I think the big concern's got to be that there is a longer agenda for the Tories and the Liberals. And over the longer agenda, what we end up seeing is that you end up with commissioning hubs, and you don't have a National Health Service as such. I mean, everything moves off into the private sector, with commissioning hubs commissioning from the private sector. So the actual physical structure of the health service disappears. You end up with the right to the service at the point of need. Another point on care in the community. I work as a social worker with adults. And certainly in terms of the cost of care in the community, it isn't a cheap option. So if you're making cutbacks, it's going to impact there as well. The packages of care, I'm sure as you know, that actually go into the community are very expensive. In some cases, they're more expensive actually than the alternatives. And just one final point, in terms of what we actually do, I think we should always remember that, for the average politician, the one thing that really scares them most is losing their job. And we're just a matter of weeks away from council elections. Now, whilst councils may not be responsible for the NHS, I believe that every Tory councillor, every Liberal Democrat councillor is responsible for the policies that are being carried out by their government. And if you're going to make them change their mind, then put pressure internally on their parties, you need to make the NHS an issue everywhere, and it every time. We had the leader of the Liberal Democrats, I think it's in Liverpool, who's basically been going off on one recently, seeing what a terrible mess they're in. And obviously he's running extremely scared. I'm running for the Labour Party in Solway Bridge in Calderdale. Certainly the stuff that I'm intending to put out, we'll be talking about the NHS, and we need to put that sort of pressure, as well as all the other things that we're talking about doing. We need to be putting that sort of pressure and making every elected member of the Liberal Democrats and the Tories feel the pressure of what they're attempting to do to our NHS, because it could be cataclysmic.
Thank you. I'm very aware of the time. It's 10 to 9. We have to be out of the room by 9, I think, as opposed to ending the meeting at 9. Yeah. Bob wants to come in and say a little bit more, and then I'm going to ask Paul to finish us off, because you said that there was stuff about, you know, unions and stuff, and yeah, you could point people to things that, you know, beyond the meeting. So if people are okay with that, that's how we're going to take the last 10 minutes. So Bob wanted to come back and...
Yeah, I mean, I agree. I share the concerns about the way this could work out. That's why I suggested that there should be piloted runs in restricted areas to see exactly what did happen when these plans were introduced. It's very easy for the Labour Party to sit back and say, well, we'd spend this and we'd do that and we wouldn't cut that and we wouldn't cut anything else. And that was something which the Lib Dems, of course, enjoyed for a long time. But you've got to be realistic. The country is spending £400 million a day more on its services at the present time than it actually gets in terms of taxes and that sort of thing. And that is something which you cannot allow to continue indefinitely. I'm all for the NHS being ring-fenced. Would you like, as a Labour Party member, to suggest a number of areas where savings could be made, and don't just say by efficiency, because that's...
Right.
Well, we could have, I mean, a transaction tax, a Tobin tax, there are a number of areas that you could actually look at, you know.
Yeah, but you're not going to mention them, are you?
Well, I've just mentioned the transaction tax.
Well, let's...
Scrapping Thailand.
It's a difficult situation, and I appreciate it, and I will personally do my best to see that the NHS
Keep people in work like that lady
continues to be the organisation it has been in the past, and I fully support the principles of the NHS.
Thanks, Bob. Okay, I'm going to ask Paul to be the last person to speak, and then when he's finished, just hold on a second before you start to leave, because there's one or two announcements that I want to make as well.
Right, okay, we'll just take a couple of minutes if we can. This gentleman here, you were talking about the aspects of the NHS being together and so on.
Yeah.
One of the key benefits of a national, and I do stress the National Health Service, and it hasn't been this for a long time now, but was the aspect about sharing. You know, some clinician somewhere, or some nurse somewhere, comes up with a great idea. A brilliant advance. Research is carried out. It's called evidence-based practice. What we then are supposed to do is share that. My hospital will share it with a regional network, it will go to a national network, and we all start to adapt. Now, when you have competition, you cannot have collaboration. And in this legislation, collaboration is actually forbidden because it falls foul of competition law. That is the sort of situation, the extreme situation that we're facing. Hospitals will hold their own advances in care within their boundary, and they will not share it because it perhaps gives them a marketing edge. Because we're going to be spending money, a lot of money on marketing and advertising and promoting, so that you will come to us as opposed to them down there. And that is despicable when we're talking about, as I said earlier, one of the finest investments any civilized society can make on behalf of its people, and that is the health as well as education of its people. And it's abhorrent to me, and this legislation deserves to be damned into non-existence. This is not a petty fight, this is a major, major fight, and we've all got to play a vital part in that. in terms of what you do, I think I have already mentioned about the different websites and so on. If you Google NHS Build, you will get a myriad of sites coming at you. Okay, thank you.
Thank you.